Dear students, we are in the fourth part of cerebral palsy topic and continuing from the third part. So we have been discussing about the treatment, which is operative treatment. So third point is reduction of spasticity through operation. It is neurectomy, but most of the time in cerebral palsy it is posterior rhizotomy. Then the fourth factor in the treatment is to stabilize uncontrollable joints. So sometimes when after other deformity correction, the joints may be become uncontrollable. So stabilizing that, operative procedures may be used. Often procedures can be combined, and adductor tendon release can be done at the time of pelvic osteotomy for hip subluxation. So many kind of surgical advanced techniques are available now. So all these are very much useful. So physiotherapy, coming to physiotherapy, physiotherapists play a crucial role in all aspects of the care of cerebral palsy children, including identifying children who may have cerebral palsy. That means diagnosing, that treating their spasticity and contractures, fabricating splints and simple braces. Mainly we are talking about prescription of splints, and that is orthosis, orthotics, and providing family education, follow up, acting as a liaison with the school and other healthcare providers, and implementing home stretching and home exercises programs with the patient and their families. So the treatment techniques commonly used are neurodevelopmental therapy techniques. These techniques are following the two important aspects, that is therapeutic handling and reflex inhibiting positions. So this is very helpful for cerebral palsy treatment. Roots approach, which is actually the Margaret Roots approach, which is given for both facilitating and inhibitory technique. So wherever there is hyperreflexia or spasticity, we have to give inhibitive technique. Wherever there is hypertonia or weakness, we have to give facilitatory technique. Sensory integration therapy, Gene Harris technique, which is mainly integrating all the hypersensitivity or hyposensitivity the child may have. In cerebral palsy, it is also commonly seen. Sensory disturbance are also commonly seen. Associated problems are also seen. So sensory integration is also very useful. Stretching and strengthening exercises. Stretching has to be provided to maintain the range of motion. Whenever the range of motion is maintained, what will be there? There will be no deformities. So strengthening is only next to stretching. Without stretching, if you're giving strengthening exercise, it is not going to be effective. In cerebral palsy children, only resisted strengthening exercise are only given post-operatively. Otherwise, we don't advise resistance based strengthening exercises. So otherwise, strengthening exercises means we are talking about task oriented exercise, motor relevant programs, all those visual imagery techniques, or these techniques which are mainly used to improve function, and strength is improved not by resistance but by function. So functional strengthening is what we are meaning here. Voita therapy, which is early intervention therapy, it is based on by a German physician called Dr. Voita, which is very effective in the early area time of the the developmental improving developmental milestones. Aquatic therapy, hydrotherapy based treatments are very effective nowadays, especially the child becomes very active, but very good expertise and precautionary techniques and good infrastructure is necessary. Microgravity therapy is nowadays very advanced treatment, both microgravity therapy and suit therapy. Various suits like Adeli suit and Thera suits are very commonly and most useful in the treatment of the children with cerebral palsy, mainly in improving their mobility pattern and reducing spasticity, controlling their posture, maintaining the posture, and reducing their cost energy expenditure for mobility. So these techniques, most of them are, many other techniques are there, but these are the major techniques which are commonly applied. So what are the treatment plan for physiotherapy treatment plan? So treatment plan is, without a good treatment plan, physiotherapy techniques are not going to be effective. So the treatment plan to maintain range of motion of all affected joints. So what will happen if my range of motions are maintained? Flexibility will be maintained. So that means that the functional capability will be maintained. All kind of reaching activities will be maintained and progressed to prevent contractures and deformities, to strengthen the weak muscles, to position appropriately in all static functional positions as well as in dynamic positions, to train gross motor and higher gross motor functions appropriate to milestone development, to prescribe necessary orthotic appliances and equipments for corrective, supportive and therapeutic benefits. These all factors should be incorporated inside the short-term goal as well as long-term goal treatment plan of children with cerebral palsy. My dear students, we are completing this topic, cerebral palsy. Thank you. I hope that this will be useful for you. Thank you.